Hello, everyone. Welcome to another meaningful conversation on our Connecting the Dots, Engaging Our Community Town Hall. This is March, and March is National Kidney Month, and OneLegacy is working thoughtfully and strategically to bring community leaders together throughout California and throughout the country, in that fact, to have conversations about organ, eye, and tissue donation. This webinar specifically during National Kidney Month is to discuss the higher prevalence of chronic kidney disease and the need for kidney transplant in communities of color. This panel will focus on social determinants that leads to poor health outcomes for communities of color and how we can work to address the need for kidney transplantation through awareness, education, and donor registration. I do want to just state a few facts that there are over 100,000 people waiting in need of an organ transplant, and that's men, women, and children. Of that 100,000+, 90,000 are in need of kidneys. So if we do the math, there is a big gap in the need for kidneys and other organs. And with that, of that 90,000, 60% are communities of color. And so we are really looking to come up with effective ways and strategies to help have better outcomes for communities of color, determine where the conversation needs to start, what screenings that we can help provide, and how we can just provide meaningful insight that could potentially encourage someone and ultimately save a life. We are going to do something a little different on this panel. We have Tanya Lavinares here, who's part of our public education department. She manages our media relations, and she is also our spokesperson for Hispanic media. Tanya will introduce our guest host of the day. Tanya.
Hi, thank you very much, Tiffany. So hi, everybody. Hola a todos. Welcome to our 9th episode of Connecting the Dots, talking, as Tiffany said, about kidney health and the importance of keeping your kidneys healthy. So a little bit more about our population. As you know, we have a very diverse population in Southern California. And according to the census, African Americans account for 13.4% of the national population, and Hispanics, Latinx account for about 18.5% of the national population. While between these two communities, we make about a little over 30% of the population. Between African Americans and Hispanics, they make about 50% of the current transplant waiting list. So the need is great. African Americans are the first patients, the largest group in need of an organ transplant with 28.5%, and Hispanics and Latinos are the second largest group with 20.5% of the waiting list. So the need is absolutely great. We have an amazing group of panelists here. We're going to talk a little bit about more about the need. And before I go and introduce Gabriella, I want to remind everybody that the last 15 minutes of this town hall will be for questions and answers, for Q&As. So make sure you prepare your questions. You can submit them on Zoom on the chat feature. And if you're joining us on Facebook Live, you can also actually share it in the comments, and we'll make sure we share them with our panelists. So, Gabrielle, I have known you for so many years. She's a wonderful friend. Thank you very much for joining us today. And I'll give it up to you, Gabriela. Gracias. Gracias a todos. Bienvenida.
Thank you, Tanya. Thank you so much, Tiffany. I want to thank OneLegacy for this Connecting the Dots series. They are wonderful. We have worked really close with OneLegacy at Univision, where I have been a show host and a news anchor for close to 20 years. I'm going to say well over 70. That puts it really close to 20 years. My job here today is to bring us to a conversation where we can talk about organ donation in a human way. I know that OneLegacy has done all this job, and I know that you guys know that this month is a kidney health month. So the numbers and what Tanya just gave us is like, it's really sobering. And when we look at these numbers, we got to think not as an organ, but as a person. as a family, as a community? What does this do to you? Why are you here today listening to this particular webinar? I think that that is what connects us all right now, right here, connecting the dots. I want to introduce our panelists. And first, I would like to ask each of them to just tell us briefly what connects them to today's point here, to today's event. And I'm going to introduce first Anel Aguirre. Hi, Anel, how are you?
Hi.
Anel, I'm going to tell you, wait, give me 1 second. OneLegacy Ambassador and kidney transplant recipient. Adelante, Anel.
My name is Anel Aguirre, and I'm a OneLegacy Ambassador for 2 years now. What connects me to OneLegacy or to organ donation is that I was born with kidney disease, and I was born with only one kidney, and that kidney unfortunately stopped working at the age of 12 years old. I started dialysis, and then exactly about a month later, I was receiving the gift of life, a kidney transplant that literally saved my life. And I've had the kidney transplant for almost 26 years now. August 30th will be 26 years. And I'm just here to, share my story, share my experience, and, just to give other people hope. People who are just recently diagnosed or that are in dialysis or just recently received a kidney transplant. And just sharing my story hopefully gives them hope and, just looking forward to the future of having a long time with their kidney.
Looking forward to our conversation. Thank you, Anel. I would like to introduce next Morgan Reid, who's Director, Transplant and Policy and Strategy at the National Kidney Foundation. But she's here today as Morgan Reid, a wonderful woman. Hi, Morgan, how are you?
Hi, Gabriella, and hello to everyone. Thank you for listening. What connects me to donation and transplantation is my best friend in college donated her kidney to me 15 years ago. I was diagnosed with IgA nephropathy when I was 18. By the time I was 21, I went into full kidney failure. I was on peritoneal dialysis just shy of 2 years before receiving the gift of life from my dear friend Kelly. And I have been very thoughtful about how I'm going to give back. And, my best friend asked me twice if she could donate her kidney to me. And the first time I could not wrap my head around, how am I going to pay her back for saving my life? And she asked me a second time, and I decided that I was going to dedicate my life to this mission. I have worked for 2 organ procurement organizations. I have worked for a highly esteemed transplant center, and now it is a great privilege and an honor to work for the National Kidney Foundation, again, amplifying the need for kidney disease awareness, prevention, and education, and then also helping kidney patients access the transplant waiting list. So I am paying it forward because of the amazing gift that I received from Kelly.
Thank you, Morgan. This is going to be very inspiring. Thank you so much. And next, we go to Ernesto Blas, who is OneLegacy Donor Development Coordinator for 13 years. Ernesto, you just said.
Yes. Thank you, Gabriela. And I think that you put it perfectly and beautifully. If we don't think of this as just an organ and think about it, think of the person, think about the family that's affected by this. And I couldn't have put it better myself. And I feel privileged to be on this panel with 2 other individuals whose stories are much more interesting than mine. My role at OneLegacy has been working with families. Because I am bilingual, I have had the privilege of working with numerous families that are challenged with the language and understanding medical terminology. So my job was to sit with them and talk to them and explain to them what the reality of donation is, because there are so many misconceptions about donation, especially in the Hispanic community and the African American community. I think that the idea of donation is not something that they think about. And because of all the misconceptions out there, most of them would say no initially to donation. It's not until people that are trained to sit down with them and work with them and talk to them about the opportunity of saving others do they realize that donation was not what they thought it was. And most of them come out of there authorizing or initiating donation and think of it as a wonderful opportunity.
And that is a true remarkable job, because being a Latino myself, coming from Mexico, I tell you, that is a very touchy subject. You don't talk about death, you don't talk about illnesses, you hide it under wraps, and that is not what we're supposed to do, because this kind of event is what's going to bring us together to be able to talk about this.
Yes.
So let's start with the numbers. Thank you very much, Ernesto. Let's start with what Tanya was telling us and what Tiffany was saying, and it just makes me, it just froze me. 100,000 people waiting for an organ to be donated to them to continue with their lives, and here we are, and not everybody signs in to become a donor. So let's start with you, Ernesto, because that is a very important subject. How do you open up the conversation, and when, with these families?
There's a lot that has happened in the hospital before we meet with these families. As in OneLegacy in itself, we only handle deceased donation. These are individuals that are at our hospitals that have suffered either a traumatic or an anoxic brain injury, and the hospital has done all that they could to try to save this patient's life. And once the hospital gets to the point where they know that they have done everything that they can, and there is no other opportunity now, and they have informed the family that their loved one has either passed through a process called brain death, or that their loved one will probably not survive their injury, that is when OneLegacy now steps in. This is a very, very touchy subject, like you said, for all individuals. Our process starts with sitting down with the family and understanding what they understood from what the hospital has explained to them about their loved one. Once that process is complete and they've explained to us that they understand that their loved one is gone, or they understand that their loved one will not survive, at that point, we let them know that there is a very unique opportunity that's not a lot of people face, and that is the opportunity of saving others through the process of organ and tissue donation. Yes.
Most of these families are in denial at some point in time. Do you come in when they are already knowing this, or who else is in there in the mix to help you out with that phase?
Well, we work hand in hand with the hospitals. So when we've stepped in, it's when the hospital has already told them that their loved one is either gone or not going to make it. And yes, you are correct. We are faced a lot with families not understanding what the end result is. And sometimes our process for the first few hours is explaining to them the tests that were administered, what the hospital was looking for, and what the end result was, in order for them to understand that this is something that the hospital's been not only trying to treat, but they've tested. And the results are in, and these are the results. So if at that point the family is still at a process where they don't understand, at that point we do invite the hospital partners to come in and help us explain with more medical terms what the final diagnosis or prognosis is.
I ask you this because I think it's very important to bring into the conversation what we Latinos have in common with people of color and with faith-based communities. We put everything in God's hands. And at that point, I'm going to stop you there, Ernesto. I'm sorry for a second. I want to go immediately to Anel, and I'm going to ask her, how was it? Because for you in particular, you got a kidney, and your life was also there on the balance, and you were born without a kidney. So it's a different situation, right? As if you, in case you're in other situations, a kidney fails, but you were born without a kidney. How did that affect or not affect everything that we're talking about here?
So for me, it affected where, I mean, I guess for me, I was used to it because I was born like that. So I didn't know any better, right? It wasn't like I was born, quote unquote normal. And, and all of a sudden my kidney stopped functioning and, all this stuff. But for me, before kidney transplant, I was always like really exhausted. I couldn't focus in school. I just couldn't, I didn't have the best quality of life, you could say. I couldn't be a kid. And then I know that once I received the kidney transplant, everything literally changed completely. I had all this energy that I've never felt before. I was able to focus in school. I went from from D's and F's to straight A's, like overnight, just because I had all this energy. My kidney was functioning, was doing the job that it's supposed to do. And, I was able to focus. I was able to, pay attention, and because I had the energy, right? So for me, it was a great blessing, and thank God, I got a really, really good kidney that now, like I just said, it's almost been 26 years, and that's very unheard of. Every time I meet a new doctor, a nurse that, they know about kidney disease, they are shocked. They're shocked to learn that I've had the kidney for so long.
Mm-hmm. So your testimonial is really empowering for so many people who say, I did nothing wrong. Here I am with one kidney. I need help. And in your case, Morgan, you were already knowing what was happening to you. You were a little bit older than Anel at that point. And you're like, what happened to me? How did you feel at that moment when you know that one of your kidneys is failing?
I was in shock. When you get the news that your kidneys are not working, you're going to have to start dialysis, you will eventually need a kidney transplant. Hearing that at 21, and you have to think, when you're young, you think you're invincible, right? You think nothing's going to happen to you. And that could not be the farthest thing from the truth. I was in shock. And I honestly, I didn't know what to think. With anything else, anytime you're encountering the unknown, there's fear. So I was afraid, but I had a lot of support from my family. I had a lot of support from my nephrologist. When I started dialysis, my dialysis nurse was my everything. She got me through the dialysis process from the first time I met her. And I'm one of the people, you all may have heard that term, crashing onto dialysis. These are people that they're so far along down the path of kidney disease that it's the next step is, I'll just say this, I walked into the emergency room. I didn't feel like myself. I didn't feel normal. And my blood pressure was 228 over 160. My creatinine was 18. For anyone that understands those numbers, that's really, really, really high. I had cerebral edema. I was a mess. And I remember the emergency room doctor saying to me, your age must be on your side. I'm shocked that you're standing right now. I've never seen anyone with a creatinine as high as yours. Your blood pressure is high. But it was a shocking moment for me. And I remember starting dialysis in the hospital. And that is where I met my dialysis nurse, who stayed with me until I had a transplant. So it was Judy, as her name. It was Judy that got me through the process. So having support is really important.
And having faith and having hope. Morgan, I don't want to let you go. I want to ask you really quickly.
Of course.
Tell us about your organ donor. It is very important to know that mindset, that person, what is she thinking?
So Kelly and I'm from New Jersey, and we both commuted to a university in New Jersey. We lived right outside of Manhattan. She and I would hang out on campus all day long, and all of my friends would go and party in New York City at night, and I couldn't because I was on peritoneal dialysis. I would go home at night, hook up to a dialysis machine, and one day Kelly asked me, why don't you want to hang out and party with everyone else? We hang out on campus all day. I don't understand why you won't come hang out with us. And I finally shared with her, I am on dialysis. I need a kidney transplant. This is why I can't hang out with everyone. Kelly went and asked her mom, what's my blood type? And of course, her mom's like, well, why do you want to know your blood type? And she says, well, my friend needs a kidney and I would like to give her a kidney. And like any mom, she was apprehensive, worried. But when anyone asks Kelly, why did you donate a kidney to Morgan? She will always say, people have few opportunities in life to do something as magnificent as donate a kidney to a friend. And that is why I did it. So Kelly is my sister for life. I don't know if I would be here without her. And talk about connecting the dots, right? This is my purpose. This is why I do what I do. And this is why I'm committed to helping other people like me get transplanted and receive the gift of life.
That is incredibly touching and moving, coming from a young woman that has life ahead of her. And she can say, you know what, let me help this friend of mine. And she needed, of course, at that point, more support to become a donor, right? So she goes to her mom and she asks the mom, and Ernesto, bring us back to the family. So here's a live organ donor, and she goes to the family. And how does that family react? What do you see when you go out there and talk to the families, Ernesto?
So I'm working with the families that are losing their loved one. They're going through a very, very tragic time. Our job is to provide them with the information for them to make a decision based off of the correct information in front of them and not based off misconceptions. I would just like to stop and say, because of people like Morgan and Anel, I get up every day with a purpose. And when I meet people that are in need of transplants, I let them know, just know that there's a community of people that are working every day to help you get that organ that you need, to help your loved one get that organ that they need. So, I may not be directly involved with them getting a transplant, but at least I know that I go into work every day looking for an opportunity of helping a family with that process. So that being said, when we're working with those families in hospitals, we're just there to support them and give them the information that they need. And hopefully, if they say yes to donation, bring them one step closer to understanding that their loved one's legacy continues on. It doesn't end with their death. And that is something that our donor family ambassadors, they really repeat on a daily basis, is that if they wouldn't have donated, they wouldn't be here that day talking about their loved ones saving others through the process of organ donation. So it's a very selfless act that they're doing. And for those that are registering already, it's something that they want to do. They want to make sure that if they're not able to be saved, that they're able to save somebody else. And that's what we hear when we're working with families.
Yeah.
And if I can just jump in really quickly to, just to piggyback off of what Ernesto just said, having worked in the OPO world for almost a decade, that is so true. I think people don't realize how meaningful it is to donor families to have the opportunity to donate their loved ones' organs, because it's a little glimmer of light in a very dark circumstance. And as Ernesto said, knowing that the legacy of their loved one is continuing on by helping other people live helps them to get through the grieving process.
Absolutely.
So I just, it is a privilege and an honor to sit with donor families, to support them through that process. It is a reminder that there is good in the world, despite all the craziness that's going on. There are people out there that truly want to help others. And I just had to say that because whether you're a living donor or a deceased donor, donor families and living donors are just, they make the world go round. They give life. And I appreciate you saying that, Ernesto. I just had to jump in there and echo your sentiment.
Yes, this is important because you guys have experienced that firsthand, Morgan and Anel, and your cases are very different because of the age range, because of so many reasons. And I don't know about Anel's donor. Anel, can you tell us about? Can you elaborate, please, on that?
So my donor actually was a deceased donor, and I don't know much about him other than it was male, 26 years old, and very healthy. That's all I know.
Mm-hmm. Did you ever meet the family? Because I know that OneLegacy sometimes helps facilitate that.
No, I've never met the family. I've never heard from them, and I've never tried reaching out to them. Just as I'm getting older. I don't know why I just thought about, trying to connect with them, but it's now been so many years that I don't know, if I'll be able to connect with them. But, I just always wonder how he was and, character wise and his personality. And if I adopted any of his personality traits or because there's some things that I may like that it's kind of like weird, I guess, for me to like. But yeah, I've always wondered, and I wish I would have at least had a picture of him or something, or know more about him. And I try to live my life to honor him because he did give me a second chance to live. So I just want him to feel proud and feel that what he gave me is not in vain.
Yeah. So can you please take us through that? Do families want to eventually meet the person who is receiving organs from their loved one once is deceased?
So that's very rare. It's actually less than 10% of deceased donation families actually do meet. It's a process that that takes place if families want to communicate. A lot of times it's the OPOs that will handle that communication. They will have all correspondence be mailed to the OPO. The OPO would forward that information. When families do meet, it is something that OneLegacy does arrange if both parties want to meet, but it is very rare. It's less than 10% actually of families that are meeting.
And that is very important. I remember OneLegacy has every year their float at the Rose Parade, and we have those pictures of those organ donors, and they have the families that donated organs as well as people that have received. And it's so moving to see them together because that connects them. Just some have given their organs, some have received their organs, and so just to see them all alive in a way at the same place, even though some of them are deceased. Can you, Ernesto, tell us a little bit more about why is it important to get probably organs from a living donor rather than a deceased donor?
So we don't handle living donation. Those are usually handled through the transplant centers. Their process is probably their matching process, and the tissue typing is probably a little bit more exact than on deceased donation. On deceased donation, obviously the deceased donor is at a hospital or is at a recovery facility going through testing processes. We're submitting that information to the transplant centers. They are trying to match it the best that they can to their recipients. And at that point, we're hoping for the best outcome at that point. Whereas at the transplant centers, it's a little bit more controlled. So I would say that's probably the biggest difference.
I started saying I wanted to get a better picture of you all, and I think that another point that helps us connect all the dots is the trust in the Latino community, in the African American community, in the United States, specifically here in California. Our communities don't have access to a regular medical practitioner who's our doctor. And then we get ill and we go from clinic to clinic, or we crash at an emergency room. And all of that makes us not necessarily trust in the medical field. And then here we are with a major situation where we need a kidney transplant. How does anybody trust in a clinic where they have never been or where they just met because of the situation? Morgan, tell me a little bit about this, because I want our communities to trust in the medical field and to understand that that before they get into dialysis, they can potentially already get better kidney health to begin with.
Yeah, you bring up a really good point, Gabriela. I always think that education is the most important thing. Physicians or any provider spending time with patients, developing a rapport with them, answering their questions, allowing them to become active participants in their healthcare. Some of the things that we're really focused on from a policy perspective at the National Kidney Foundation is improving patient centricity within the nephrology community. We want nephrologists to center patients, to think about them, to include them in their healthcare, again, just to develop that rapport, allowing them to become active participants and decision makers in their healthcare will hopefully help to build trust and break down those walls and those barriers that people feel when they walk into a doctor's office. Mm-hmm. To me, it's just all about education, education, education. But it's even deeper than that. You know, when we think about social determinants of health, when we think about health equity, these are important factors that play into a person's health status. When you look at people of color, African Americans, or the Hispanic or Latina community, or Latinx community, some of our culture contributes to, you know, kidney failure. The two leading causes of kidney failure are diabetes and hypertension. So how can we get ahead of that? How can we help people in the community become educated on how to prevent kidney disease or manage it better so that they're not progressing to end-stage renal or kidney disease and ending up on dialysis? And I actually, if you don't mind, I would like to go back to living donation just for a second, if we can. This is why it's really important to, so I'll just say this, at the National Kidney Foundation, we are also focused on increasing living donation and deceased donation education. We want people to understand what's happening in their communities. What is the need in the Hispanic and Latino community? What is the need in the African American community? And explaining that and educating people within the community on the needs. Living donation is really important to understand. When I was going through kidney failure, and I asked, you know, my family members, my siblings, my cousins, if they would consider donating a kidney to me, they didn't even know that that was a possibility. Some people don't know that you have two kidneys and that you can donate one and live a very full, long, happy life rather, with one kidney. So again, for me, a lot of this stuff goes back to education. The more you know, hopefully the better one will do.
Yeah, Anel, I want to ask you, since you're OneLegacy Ambassador, what do people tell you? I've known a number of ambassadors with OneLegacy thus far, so many years working with them. What do people tell you when they reject at first, the idea of becoming a donor, either in life or deceased? What do they say? What do they cite?
I think they just have like misconceptions about organ donation. They think that because their driver's license or their ID has that pink dot, that if they ever needed, medical attention, that the paramedics or the doctors or the nurses will see their ID and say, oh, they're registered donors, then we're just gonna let them die. And that's far from the truth. And that's the most common misconception that I've gotten, or people are just not aware of how organ donation works.
Mm-hmm. What about religious belief? Do they sometimes cite that as well? because I know that the Pope is an organ donor. Just saying. So, you know.
I haven't received that, and not that I know of. It's more of like just lack of education, to be honest, or just, you know, the like the comadre dijo, you know, said this or that, you know, like there's just a word of mouth where, you know, instead of getting educated by someone who does know, someone who either, you know, it's educated on organ donation, or someone like me who has gone through the process of organ donation. And for me, like the easiest way to share my, what organ donation is, and I guess kill the misconception, is just sharing my story and say, you know, this is what happened for me, and sharing others, you know, stories of other people who I know have gotten an organ donation from a living donor. Yeah, just sharing my knowledge and sharing my experience. I think it's has been the best way to educate people.
Yeah, absolutely. Ernie, Ernesto, if you want to share with us a little bit of what again, going back to that place where you are approaching this family. And I know I have spoken to several families who've had their beloved ones go, and they have very limited time to make a very tough decision.
Yes. Once a family has taken a hospital has taken a family to the point where they've explained that their loved one is gone, the family is given a reasonable amount of time to say their goodbyes. At that point is when we've talked to the families, and usually hospitals have already set parameters as far as time that the families are going to be allowed to say their goodbyes. So our objective is to ensure that we give them all the information so they can make an educated decision. And that's just ensuring that we've addressed all of their questions. And like Anel said, the number one response that we get from the community is they believe that if a person registers to become an organ donor, that the hospital's not going to save their lives. And I speak to 2 to 3 groups a week. And these are medical, either students or nurses. And I ask the question, why don't people register to become organ donors? And that is the common misconception, is they believe that the hospital is not going to save their lives. And the nurses will actually chuckle because they understand that none of them went to school for organ donation. All of them went to school to save that patient's life, to save that individual coming into their facility. And OneLegacy only gets involved, or organ donation is only an option when the hospital's done all that they could. And now the decision is for that family to make the decision on extending their legacy through organ donation, or allowing their loved one to go. So my job again is to educate them, whether they say yes or no. You know, what we tell the families is this has got to be a decision that's going to bring a family together. It should not be a decision that separates this family, because if it does, then maybe organ donation is not for that family. And when you said earlier something about the families retaining to that hope for a miracle, you know, we're not there to take hope away from them. What we're there to do is explain that there is an opportunity of saving others. And if their loved one registered, then they kind of understand who their loved one was, to give at such a moment that it truly is a very selfless act, and only true heroes, in my belief.
Sorry, can I add something? And also, like, part of my education is letting them know that actually the doctor who is caring for the patient is not the doctor that determines that the patient is brain dead. It's actually separate doctors that are not involved with the care of the patient.
Thank you, Anel. Thank you, Ernie. Going back to you, Morgan. As I was saying, this is for some families who don't even want to talk about death. And now they're faced with making a tough decision in limited amount of time. What are the right strategies to make us as a community become more human and being able to help others before we get to a point like that?
It's having really tough conversations. You know, as you mentioned, and I think Ernie has mentioned too, we don't want to talk about death. We don't want to face our own mortality. But if there's one thing that is true, it is that we are not going to live forever. And I always share with people, share your wishes with your friends and your family. Let them know. You have to talk about these things. Just working for, again, 2 organ procurement organizations, you meet many families, right, Ernie? You meet so many families, and some of them have had these conversations and some of them have no clue what their loved one would have wanted. Some people are aware that their loved one has put organ donor on their license, and then you meet some families that had no idea that their loved one put organ donor on their license. And the one thing, again, that I would communicate with people, and I still do, is share your wishes with your friends and your family. If you're someone that doesn't believe in organ donation, I would learn more about it. To Anel and Ernie's point, yeah, I have heard so many people say, if I put it on my license, no one's going to save my life. And I'm going to tell you, when someone's being rushed to the hospital, the nurse, the physician, no one is asking for your license. No one cares about what is on your license. They are doing everything in their power to save your life.
Yes.
And once the nursing team and the medical team have done everything that they can do after they have exhausted every possibility, it is then and only then that organ donation becomes a possibility. And as Ernesto said earlier, it is less than 1% of patients are going to die via brain death. And that is the population that can become organ donors. Or you have patients that have suffered a neurological or anoxic brain injury, as Ernesto has said, that doesn't meet brain death criteria. And at that point, other conversations have to be made. But once a patient in a hospital, once it's been determined that a patient in the hospital isn't going to get up and walk out, it is then when those conversations start happening. And that is after the hospital's done everything that they can to save that person.
So how do we change that conversation, Morgan, since I have you there? How do we change this conversation? Because we're not going to meet those needs with 100,000 people waiting for an organ, 90,000 plus waiting for a kidney. How do we change this conversation?
For me, it goes back to education. And I think organ procurement organizations have to become really active in their designated service areas and educating the people that are in their DSA about donation, deceased donation. I think transplant centers have to roll their sleeves up and get involved in educating the people in their communities about living donation. You're right. The list is long. And there is a national organ shortage, and it is a public health crisis. And we all have to put our heads together to figure out, how are we going to transplant the people that are on the waiting list? When it comes to the National Kidney Foundation and the initiatives that we're focused on, again, we want to see increased education when it comes to living donation. When someone receives a living donor or a living donation, it takes that person off of the list and makes the people who are on the waiting list waiting for a kidney, it makes their waiting time shorter whenever you can have someone become a living donor. Really, it's just about educating people about this process, educating them about deceased donation and letting them, and dispelling myths. Like, you can put it on your license, or some people may think, well, I don't know if my religion supports this. Dispelling those myths as well. Again, I cannot emphasize enough to, I think Ernie said it, Anel said it, it is all about, you don't know what you don't know. Yeah. People don't know what they don't know. And it's hard to make an informed decision when you don't have the facts. Yeah. And that's why when you look at the transplant ecosystem and the stakeholders within it, OPOs, dialysis centers, transplant centers, and again, I'm speaking from the perspective of nephrology as someone that works for the National Kidney Foundation. So I don't mean to exclude any other particular organ, that's just my focus. But again, it's just it's about all the stakeholders coming together and genuinely working for patients, putting people at the center of their initiatives and working hard for the people in our communities.
Yes, and getting the message out, talking about it. I tell you, it's just hard in the Latino community. You bring things like this up, and people are like, wait, I don't want to talk about it. I mean, it's hard, but you have to start the conversation somewhere. I'm going to read a question here. And Anel, I think that you can answer that, but I invite the other panelists to also pitch in. It says, Kathy writes, I often get asked by students when presenting about organ, eye, and tissue donation, why kidney transplants typically only last 10 to 15 years. Would like to hear how you typically respond to that question. Anel.
I'm not sure how to answer that question because mine has lasted 26 years. So for me, it's more of just sharing my, my story, going back to just sharing what, my experience has been. And obviously I don't have a magic pill, right? Why mine has lasted longer than the average. Mine should have only lasted about 10 years and now it's double. Hopefully it will be triple the time that, it's the average.
And when you ask doctors about it, what do they tell you? Why is your case like this? Do they have any ideas?
The only thing that I get from doctors is that it's truly a miracle. And two, they just can't explain it, that I just got really lucky with a really good kidney.
Yeah, some people get really lucky and it's about taking care of that kidney. But I will also say that certain disease processes come back. My kidneys failed because of IgA nephropathy, which is an autoimmune disease, and it could potentially come back. So, I mean, that may be a reason as well that someone goes into rejection later down the line. It varies.
Yeah,
the reasons vary.
Yeah, and going with that, I think that is also, it just depends on the cause of your kidney failure, right? So there's so many unknown causes, and also getting to know those to prevent kidney rejection and prolong the kidney transplant.
Okay, moving on, I want to read Raquel Gonzalez's message that she wrote here on the chat as well. She says, I'm a donor mom. My daughter saved 3 lives and improved the lives of many others with her organ and tissue donation. 14 years later, and I am so honored to be a OneLegacy Ambassador and still have to share and be able to share my daughter's legacy. It's very healing for me and my grief journey, as it is for many other donor families. Our loved ones have left a legacy of hope. So Ernesto, this is what you were talking about, that it's that feeling that I can only imagine is so fulfilling for some. Of course, the grief will be there will be present, right?
Absolutely. And we've heard from countless OneLegacy Ambassador donor families that have stated that the gift of life that their loved one provided to somebody else has really helped them through the grieving process. And on the flip side, we've heard from families as well that have declined donation and months and years later regret that decision, look back and wonder what it would have been like for their loved one to have saved somebody else and still be a part of a living legacy. So donation is not for everybody, and it is a very timely process that some families just don't feel like they have enough time to make that decision. And we're trying to support them in every possible way to help them have that time available to them. So sometimes we're the spokesperson for that family to the hospital, asking the hospital for just a little bit more time so that they can make a better decision. And sometimes time just runs out, and it's unfortunate.
Yeah, definitely. So it's something to consider slowly and to consider every angle, as you said, not for everyone, but I firmly believe in having those conversations beforehand. I can only imagine what it is like to be in a hospital already with the stress that it implies, already drained because of probably a situation that put you there that is already painful. So for myself, it was a very easy decision to say, hey, I'm healthy. God forbid something happened to me. I do want to donate my organs. It was natural. It's natural for me that my 11-year-old son says, hey, Mom, what's this situation? Where I'm like, Definitely. I mean, if you're not going to be here and you're not going to need it, why let it go to waste, right? It's precious. Can you imagine? I mean, your organs are a precious item. What it took to build them, make them, it's a miracle itself, right? And here I read, it has been 11 years today since I donated a kidney to my son. So grateful to have been able to do that for him and grateful to volunteer for OneLegacy. That's Kathy. Volunteers as well, welcome, right, Ernesto?
Absolutely, absolutely. The more the merrier. I work with countless ambassadors, heard all of their stories, and all of them touch me just as much as the other ones. So it's amazing that I could hear their stories over and over and still have that same emotional impact when I hear those stories. And, you talked about how are we having these conversations with families. I speak at high schools as well. And I am amazed at the number of high school kids that come to me and say, oh yeah, I know about organ donation. I want to register because I know that if I'm able to save somebody else, that it's going to make my family happy. And I'm like, how did they have this conversation? Well, it's high school kids now that are just amazing me with the level of knowledge that they have on this subject. So people are having those conversations. We just want to make sure that they're having these conversations and they have the right information in front of them. What we want to try to avoid is spreading those misconceptions, those rumors about, the fallacies of organ donation, because there's so much damage that can be done by listening to some of those rumors.
We're getting close to the end, and I want to get into this question. Thank you, Ernesto. This is a question for Morgan, and it says, sometimes in the community, we encounter individuals who are on dialysis, but sometimes do not grasp the distinction between their PCP, GP, a urologist, and a transplant center. They may think that because they are on dialysis, they're automatically on the kidney transplant waiting list. In your view, how common is this kind of misunderstanding, and how can it be fixed?
I think the greatest misunderstanding is when there's a patient that is on dialysis and they've gone through the transplant process. And because there's you can either be active on a transplant waiting list or inactive. And I think the most common misconception is that a person is on the transplant waiting list and they're active, but they've been made inactive and they don't know that they're inactive and they're still thinking that they're active. This goes back to putting patients at the center of their care, communicating with patients. I mean, because here's the thing, when we look at this through a health equity lens, and we talk about health literacy, when you think about underserved communities and people, you can be the smartest, savviest person navigating the healthcare system. It's still difficult, but if you think about people that might have a language barrier or someone that truly just doesn't understand how this process works, they need advocacy from their medical team. So if that is the case, it's really important for healthcare professionals to be communicating with these patients about their status, about the transplant process. Are they active? Are they inactive? How can you stay healthy on the transplant waiting list? These are things that the medical community, the transplant team, or the referring physicians need to be communicating with their patients. The dialysis centers, if we're talking about kidney patients, it's all about communication and education to patients from their medical team.
And there's, you just mentioned something very important, because I was listening to last year's version of Connecting the Dots, and they were talking about how important it is for people to understand that sometimes somebody doesn't show up for dialysis, not because they don't want to, not because they forgot, but so many other situations that doctors probably don't understand about their life situation. So complicated, Morgan.
Very, very complicated. When you are a person, if you're sick, you still have to show up for dialysis. But you have it's important to remember that people that are on dialysis still have lives. Their parents that might be raising children, they may be caring for their parents. They still have to work. You're exhausted when you're on dialysis.
Yeah.
But that doesn't matter. They still expect you to show up, and you should, because that's what keeps you healthy in the moment while you're waiting. You know, dialysis is your bridge to transplant for many people. So you want to remain as healthy as possible, which means you need to go to your treatments. But to your point, Gabriela, it's not easy. It is not easy. And it is a compromised quality of life when you have to stop what you're doing to either go to in-center dialysis or hook up to a machine at night. You're tired, and yes, it's not easy, and that is something that must be considered.
Yeah, aspect. Ernie, there's a question here before we get to an end. I would like you to please help us out in clarifying the role of physicians at the hospital when it comes to the organ donation process, please.
So the physicians at a hospital have nothing to do with the organ donation process. Mm-hmm. Their entire objective is to medically manage and save the life of that patient. So once that they've exhausted all avenues of saving that patient's life, then that's when the testing for end of life starts on this patient. And those conversations start with the families. That is the extent of their interaction or participation when it comes to organ donation. Their whole objective is to treat the patient in front of them. Organ donation starts with OneLegacy interacting with that family after the hospital's already had those end-of-life conversations with that family. So in essence, again, the misconception is the hospital's only keeping them alive for their organs, and that's not reality. And that's not reality because that doctor is doing everything possible to try to save that patient's life. So sometimes when they see that we're now involved, they understand that they weren't able to do so. And sometimes that can be very emotionally impactful. I've had some conversations with doctors that really feel for those families because they were trying to save that patient's life. They did all that they could. Yeah. And some of them feel like they failed the family. And so, yeah, our job is to, actually, we provide support to the staffs as well and let them know, hey, things happen. You guys did all that you could. Now we have to work together in this process of presenting the opportunity to this family.
We're closing here our conversation about connecting the dots. I want to tell you, you guys definitely have moved the conversation forward in such an emotional way for us. Thank you for your story, Morgan. Thank you for sharing your expertise, Anel. And thank you very much, Ernie, for being so close to the families and understanding the process and bringing us to this point where we can say, we need more information about this. There's no reason to let our beloved ones just without the help that we can provide in life or once we don't need our organs anymore. So I want to thank OneLegacy. I want to thank also the Kidney Foundation, the National Kidney Foundation, for allowing us to have Morgan today. And also I want to thank everybody related to this event today. I'm going to turn it back to Tanya and to Tanya or to Tiffany, who's going to help us wrap this up. And I want to thank everybody that has been today in this chat. And I hope we all learn a little bit more about this because this is just grasping the surface. Tiffany, thank you.
Thank you, Gabriella, for hosting this conversation. And as you said, moving it forward. Thank you all that participated in the panel and to our guests, our participants, and also those that are watching. It's very important that we walk away empowered, inspired, and most of all, educated. There are a few takeaways. As I stated earlier, there's over 100,000 people on the waiting list, and 90,000 are waiting for kidneys, and over 60% are communities of color. So it's very important that as we know the need outweighs the supply, that we take preventive measures. As Morgan, she received a kidney from a living donor. Friends and family members can be living donors. There's resources out there. Please explore and have conversations with your doctors. Let's not just go to the doctor when there's emergency or go to the emergency room, but let's look to take some preventative measures and know that OneLegacy is a resource. Please go to our website, www.onelegacy.org. Also, this town hall is for you. It's for our community. So let us know what conversations you want to see or hear. We want to have those, and we also want to bring resources to you. Lastly, as we do as an OPO support organ donation, I do want to just highlight that it's organ, eye, and tissue donation. So you can receive skin or tissue. Also, you can receive cornea that repairs the gift of sight. So it goes beyond organ donation. There is a need for many out there, and please go to our website. Please connect with us and stay connected. And until next time on Connecting the Dots, we'll see you soon.